Hi, my name is Ryan Hartman. I'm a student physical therapist at the University of Cincinnati. I'm coming today from Guenthner Physical Therapy in Cincinnati, Ohio, and this is one of a few modules that we're doing on diabetes education. The module I'm going to be doing right now is type 2 diabetes. I'll go over some of the normal bodily processes, what's happening in those without type 2 diabetes, and I'll also take the same route and describe what's happening within the body when one has type 2 diabetes. So first off, I'm going to be using this whiteboard just kind of to help you to see exactly what I'm talking about. Helps have a little bit of visual animation. Type 2 diabetes makes up the majority of cases of diabetes. It's about 90 to 95% of the cases. It used to be known as adult onset diabetes, but within the past 10 to 20 years, that terminology has kind of gone out the window with the rise in childhood obesity and the number of children that are now developing type 2 diabetes so early on in their youth. Type 2 diabetes generally occurs in some high-risk populations, and where obesity is largely tied to type 2 diabetes. Obesity and overweight, with the amount of people that we have in the United States now in the last 20-30 years, and the continued rise in the overweight populations and the rise in obesity is really contributing. And also some of the ethnic populations that are a little bit higher risk are African Americans, Native Americans, and also Hispanic Americans. And just generally those who live inactive lifestyles and may have high blood pressure or high triglyceride levels. So first off, what I'm going to do is just describe to you what normally happens in the body after a meal. And then I'll get into describing what's going on with type 2 diabetes. So what normally happens after a meal, the carbohydrates, the proteins, the fat that we eat in our diet, it gets broken down into its smallest component forms. And the smallest form of carbohydrates is what's known as glucose. So after we eat and the carbs get broken down in our stomach and our small intestine into glucose, they end up in the bloodstream in our circulation. So I'm going to put some representation of blood glucose here for you. So after the meal we get a spike in glucose known as, which can also be called sugar, as blood sugar. Maybe something that people are a little more familiar with, a more familiar term. So what happens normally in the body when there's a rise in blood sugar, the pancreas here, which all these little circles that I'm going to be drawing are what are called beta cells. The beta cells are responsible for producing insulin, which I'll talk a lot about insulin in this video. Insulin is pretty much the main factor that determines whether you have type 1 or type 2 diabetes, and it tends to be the hormone that takes the biggest hit and has the biggest role in determining how to manage the diabetes and also what its manifestations are that could lead you to ultimately see your physician and potentially end up on a type of medication. But so after we normally eat a meal and we have the glucose in the blood, these beta cells in the pancreas produce insulin. It's the job of this insulin to get the glucose out of the blood and into the cells of the body. So the major cells where this glucose is stored are muscle, fat, and liver cells. And once it gets to these cells, it's stored as glycogen. Glycogen is just the form of glucose that is stored in tissues of the body to eventually be used as energy. So normally the insulin will act to grab onto the glucose and transport some of the glucose into these cells to get it out of the blood. What is happening here, we have all these little receptors. So all these little receptors are on the cells of the body, and it's insulin that is able to come down and it binds with these receptors, opening up channels for the glucose to go ahead and head into the cell. So the insulin will come down and it binds here, and what happens is there are glucose transporters. So as all the insulin binds, there are glucose transporters that come to the surface of these cells, basically tunnels providing an entrance for the glucose. So then the glucose is going to come out of the blood and into the cells through these little tunnels. And that's what normally happens, that's what should happen. Now I'm going to give you the same kind of a demonstration for what's happening in those who are part of the type 2 diabetes population. What's common in the type 2 diabetes population and those who are overweight and obese is there's an abundance of food and an abundance of nutrients that are not always taken care of the best way they should to be metabolized within the body. So in those who are overweight and obese, they tend to have had a bit of a habit of consuming more energy in a day than they are able to expend. So what happens is there's an increase in blood glucose multiple times throughout the day other than just at meals, or maybe the meals are bigger than some people eat, so they have an even larger rise in the glucose. So what happens is with this extra amount of glucose, this overly large amount of glucose in the blood, it's causing our pancreas here and the beta cells to work harder than they're used to. And over time, this tends to manifest itself as type 2 diabetes. Type 1 diabetes, what's known as rapid onset, with it being an autoimmune disorder, happens quickly within about a week or so. Type 2 diabetes can take as long as 10 to 12 years to show up because it's just a constant repetitive stress on the pancreas. So these beta cells are really just under fire all the time. So with the constant higher levels of glucose in the blood, these beta cells are taking a beating, and over time they tend to wear out. So we could lose some of our beta cells, and beta cells are there to get the glucose, to produce the insulin to get the glucose out of the blood, and beta cells cannot be reproduced. You only have so many beta cells, so as these beta cells are destroyed, we're really decreasing our chances of being able to produce insulin. And also, these little receptors that we had just referred to, with the increase in glucose in the blood and the constant stress on the pancreas to keep producing more and more insulin, with more glucose needing to get into the cells, with more insulin being produced by the pancreas, these little receptors eventually put up walls just because they're tired of the amount of insulin that's coming. They eventually become desensitized to binding insulin. So they may just reduce the number of receptors that they have available on a cell, or all the receptors on a cell may get to the point where they will not allow any of the insulin to bind, and that blocks the exits to the glucose that could be getting in. There are ways to manage this, and there are ways to prevent it, but we'll get into that a little more in the next module that deals with how exercise can affect type 1 and type 2 diabetes.